Thank you very much for joining us today. I'm Charlotte and I have Grant with me for a lovely conversation. Grant, you're a research fellow here at the Christie. Tell me a little bit about what that actually means, please.
So I'm a research fellow in the Christie Patient-Centred Research team. So I project manage a lot of research studies that we conduct within our team. For example, setting them up in the first instance, so developing protocols, how the research study is going to be run, and all the documentation and taking it through ethics approvals, that sort of thing. And then also the day-to-day recruitment of people to the studies.
Sounds like a really varied role. Now you say this is the patient-centred research. What does patient-centred research mean, apart from the absolute obvious?
So patient-centred research is looking particularly at patient experience, and that can mean a multitude of things, from studies looking at people's experience of the treatment, for example, that they're undergoing. It could be looking at quality of life or symptom control, but any outcome essentially that's important to patients, or indeed family members as well, as they are part of the journey.
And where does this sit within the whole kind of clinical research, clinical trials umbrella?
So I suppose really we can straddle quite a lot of the clinical trials that go on at the Christie. So for example, we are currently developing outcome measures to help measure quality of life for patients who are actually undergoing other clinical trials where they're looking at testing medicinal products.
How did you get involved in this? What's your background?
So I initially did a degree in psychology and went on and did a master's in health psychology. And I started doing research for my university more from a sports and exercise perspective. But then I joined the Christie about 10 years ago now, and it wasn't in a research role. But I got very interested when they started setting up the patient-centred research team, particularly because it was looking at the outcomes that are important to patients. And I felt it's something that could make a difference to the day-to-day experience of people who are in this unfortunate situation.
And what does a typical day, so no such thing as a typical day, I know, but what does a typical day look like for you?
So again, like you said, it's not a particularly typical day as such, but some of the tasks that I could be involved in I could be down in clinics, for example, talking to people to discuss the studies that we have to offer, for example, and what they entail, and if it's something that they may wish to take part in. It might be looking at data that we've collected from the research studies. So we can be looking at data from questionnaires, for example, so looking at people's responses. But equally, I might be interviewing people as well, talking to them in a bit more detail about their experiences, and then going through the transcripts from that. So it's quite a variety of different elements to my job. But after that as well, then we'll analyse the data that we've collected and then write about it and present it maybe at conferences or even publish it in peer-reviewed journals. So there's quite a lot to do.
There is a huge amount. And, you know, it feels like this is really, really important as well, because this is people's lives. There's a lot of data, there's a lot of clinical stuff that goes on. It's all about the science side of things. This feels a lot more human, if that's quite the right way to talk about it. It's you are talking about people's lives, people's quality of lives, and how it affects them and their families. So how does that make you feel as someone doing that?
Well, I do take an immense amount of pride in my work for that very reason. You know, it is something that we like to think helps people's experience, again, in a pretty tough time, you know, that people are going through for patients and their families. So yes, it makes me feel very proud. And I'm very proud of the organisation I work for as well, as it's an organisation that has dedicated a team to this type of research. And it's nice to be able to mirror some of the other works that's going on with clinical trials. So they may be looking at things like clinical outcomes or disease outcomes, as they may sort of describe it. But we can, as you say, take a look at the more human sort of element, I suppose, the patient's experience, and, you know, hopefully find ways to improve that.
I think there's a lot of fear and a lot of worry and a lot of concerns with some patients when they hear the words clinical trial, clinical research. There's a fear that this is the last chance, they've got no other options. There's a fear that they're going to be a guinea pig. There's uncertainties about what they're going to be doing. And there's also the big fear that they're part of some data collection that's just going to fuel, for want of a better phrase, big pharma. Mm-hmm. Is this where you come in as the patient-centred experience?
So I suppose the patient-centred experience does differ very much from the more normally well-known clinical trials that are looking particularly at drugs, for example. We do look at the individual's experience, particularly when we are doing interview studies looking at people's quality of life or experience of a particular treatment or condition. So yes, we do look at the individual data. That means there's normally a few less patients that we actually recruit to these types of studies. But as far as the clinical trials go, I mean, and for our own research as well, there are many different research studies offered at different points across a person's journey within cancer treatment. So it's not necessarily going to be towards, the end or where the cancer is a bit more advanced. It could be at many other stages as well. And as far as sort of people not knowing sort of what's going to be what they're going to be asked to do as far as taking part in a research study goes, we have a very extensive, I suppose, ethics process where we do discuss what we're going to be talking to people about and show the information to them as to what's going to be asked of them. So hopefully they do feel a bit more at ease in regards to what they've been asked. And I like to think we're a fairly approachable lot as well. So if there are any questions, we always give people the opportunity, and they are able to leave at any time should they wish.
And the ethics side of things is really important, isn't it? It's nothing gets through without being passed by the ethics board.
Absolutely, yeah. So particularly for NHS studies, and this is either the drug trials or the non-drug trials like I am involved in, we do go through a rigorous ethics process, and we always have to take our studies to a research ethics committee, and they will be essentially the advocate for the patient, and they will ask questions in regards to the actual processes, making sure that no harm comes to them. And even from an interview study, for example, like I do, they may ask, how are you going to handle if somebody feels a bit distressed? So that sort of harm as well. So it's a very robust process. And equally, for data as well, they ask what are we going to do with people's data to make sure that their anonymity is protected as well. So it is quite a rigorous process that we have to go through to make sure that everything is good for the person taking part in the study.
So how do your trials differ to the trials that are looking at drugs as such?
So for a drug trial, they will be essentially looking at how effective the drug is. They'll be looking at outcomes such as whether it reduces tumour size, for example. There are many, but that is just one of the main examples. As is looking at outcomes that are specific to the patient experience. So when I say quality of life, it can be quality of life in relation to the symptoms they're experiencing, but also from how the treatment or their condition is affecting their everyday life as well. And it might be that we're looking just to get a better understanding of the experience of a person, but equally we can be looking at interventions and evaluating how they enhance that experience as well. So for example, it might be a symptom control intervention, which we have done a recent trial on for lung cancer, looking at breathing easing techniques, cough easing, techniques, and how that affects a person's perceptions of how their symptom was managed and their own quality of life.
It feels like a really rewarding job that you've got because you are dealing with the real life, so the stuff that's going on right now.
Yeah.
How often do you see that difference that you're making?
We see it quite often, actually, particularly in regards to when we're talking to people about their experiences and maybe we're uncovering something that actually needs addressing. And if that's something that we can do that helps enhance that person's experience, and again, I say it's a pretty rough time for people, then that's something that's really rewarding, and it's something that we do see from some of our studies as well.
When you tell people about what you do as a job, what do people say? What kind of reaction do you get?
Normally it's interest. Whenever you say research, people are fairly interested if it's a sort of science-based role. But when I say that I work at the Christie as well, people become even more interested because it has quite a reputation locally and even nationally. I'm not from Manchester, and I hadn't heard of the Christie before I moved up here. But when I told people I was going for a job at the Christie, I was surprised. But, oh, really? Wow, that's a really good place to be working, because I think it does have a great reputation for experience as well, but also for treatment outcomes, and it's something that's a source of pride, I think, within certainly Greater Manchester and probably wider.
Quite often there are myths around clinical trials and clinical research, and I'm sure you've got a few in your head that you would just like to bust quite robustly. Which is the one that, if you could just bust one myth, that you could bust?
I suppose one of them actually is one that you mentioned earlier about, sort of clinical trials is the last the last chance, really, I suppose. That's one of them anyway, because as I mentioned previously, clinical trials may occur at different points, and it might not necessarily be just to look at anti-cancer drugs. It might be to look at drugs which are to help alleviate particular symptoms. It might be things like that. So there certainly shouldn't be a fear in regards to, if I'm being offered a clinical trial, that's absolutely it. That's all they can do for me. I suppose another one as well is that when you sign up to take part in a clinical trial as well, that's it. I have to continue going along. At the end of the day, the person who is the participant, the person who is taking part in the study is in control in respect of whether they want to proceed or not, or whether they want to continue or not. They may be a couple of months down the line in a clinical trial, but they still have the right to withdraw if it's not right for them. So that's something as well, I hope that sort of many people find reassuring as well.
Yeah, so the patient is in control.
Actually, I suppose there is one other thing as well, in that not all clinical trials are drug trials. A lot of the research that we do, as I say, has nothing to do with drugs, or if they are, it's more from an experience perspective. So it's not just about receiving experimental medicine, for example. Obviously we do that, and that is absolutely, something that's necessary, but you can take part in research that's not drug focused. And it gives people an opportunity to get their voice heard as well.
I feel that's really important because you're in the midst of, as we say, one of the toughest times going, and you can feel like your voice is taken away, that you're putting your life in the hands of consultants and doctors and nurses, and just to be heard is validating and important.
There is more of an emphasis, rightly so, on getting patients involved at earlier stages of research as well, getting them included in the design of research as well, and included in the running of research, just keeping an eye on things, making sure that everything is being done that is appropriate and right for the patient. So, for example, when we're designing some of our studies, we may go to a number of patients and say, is this something that you would like to take part in if it was something that was offered to you? And they may come back to us with saying, well, actually, have you thought maybe that this might be a bit distressing or something like that, and it is very valued input into our research and research across the trust as well, including the drug trials.
Grant, thank you so much for talking to me today. I really appreciate it. I've learnt loads, and including, that it's not all about the drug trials, is it? And it's all about, we can do the patient-centred stuff as well. So thank you very much.
Thank you.